Lupus is an autoimmune disease in which the body's immune system misidentifies and attacks its own cells. It mostly affects women and is usually more severe in African American, Asian, and Hispanic women. Over 1.5 million people suffer from lupus in the U.S., 5 million worldwide. Only one new drug has been approved to treat lupus in the past 50 years. Lupus symptoms can vary greatly from patient to patient.
You can't just ask every person with lupus, has your rash gotten better? Because some people will never have a rash in their entire life but have lupus. Other people, their rash will be their worst symptom.
And sometimes when a patient is sick and they go to the doctor, they're frustrated because what they're experiencing isn't what the doctor seems to be interested in, because the doctor is trying to measure the status of the disease process, but not always the impact of that process on the patient, how the patient experiences that condition.
For most of the time, a lupus patient could be completely asymptomatic and have no outward or even clinical indications that they have lupus. But for reasons that we don't understand, once in a while a lupus patient will experience a flare or a sudden and intense attack of symptoms.
Flares are a part of having lupus. They appear suddenly and unexpectedly and can land the patient in the hospital. The symptoms of a flare are well known, but right now it is a mystery why they happen and when they will occur. But what if patients could predict flares and identify the right medications to treat their unique symptoms? AMPEL Biosolutions, a biomedical research company in Charlottesville, Virginia, is creating a technology that does just that. AMPEL has created Lupro, an app that tracks a patient's symptoms over time. Lupro collects data every day through surveys that the patient can fill out on their smartphone. It uses a smart watch to monitor the patient's heart rate, sleep, and activity. The Lupro app's data will help doctors determine the next steps for the patient.
We now have real-time information that we can use to cross-correlate and decide, well, what factors could have contributed to your disease flare.
AMPEL Biosolutions will use the data to find patterns of when flares occur, to work towards a day when patients could be notified by their phones when a flare is coming. To reach this goal, AMPEL is using a powerful form of artificial intelligence called machine learning.
So machine learning is the ability for a computer to make decisions, predictions, if you will. And in order to know how to make those predictions, you have to give it a set of data that it will analyze initially to recognize patterns from.
The machine must be given a training set of data to analyze so that it can apply what it learned in future sets of data.
The more information you can put into algorithms, as long as they're designed and controlled properly, the better predictions they can make and the better patterns they can discern. So if we have a larger collection of data on what the disease looks like over a large time course, theoretically machine learning algorithms would be better able to identify maybe genes that are causing that.
AMPEL boasts the largest single repository of lupus gene expression data in the world. And I think that really sets us up to ask difficult questions. One of the biggest challenges of machine learning is having enough data to actually learn from. And we are one of a few, if not the only group, that actually may have enough to do something meaningful with lupus.
In addition to predicting lupus flares, AMPEL is using machine learning and the Lupro app to determine the best treatment for each patient. In the future, Lupro will give patients the opportunity to collect blood samples at home and mail them off to a lab. Processing this data and applying machine learning will help determine which groups of genes are associated with lupus symptoms.
And if we are able to take blood samples from a patient at specific time points that we think are crucial to disease, like when they take a turn for the worse or when they take a turn for the better. We might be able to tie specific patterns of gene expression to specific manifestations that a patient is feeling.
A report will be sent to the patient's doctor with suggestions of the top drugs that could best treat the patient, based on what machine learning found in their genes.
You know, machine learning is used for everything to identify what letters are on an envelope in the post office. It's used for facial recognition. It's used in so many applications, but here with this medical application for the lupus patient, we're going to try to help a group of arguably 1 million people across the world where there was no hope before.